Hi, my name's Eleanor Rutter. I'm a public health doctor and part of the public health team here in Sheffield. I'm just here today making 3 very short videos that are basically about reducing the chance of infection with coronavirus and the role of personal protective equipment or PPE. Just a few opening thoughts. We're very aware that this is an uncertain time. A lot of people are understandably feeling really fearful, and there's lots of conflicting stories circulating in the media that create more and more confusion. So I just wanted to take a few minutes to try to cut through some of those mixed messages to help people understand how they can reduce their own risk of becoming infected and also of inadvertently passing it on to the people that they're working with. We're very aware that some of our clients are incredibly vulnerable. I want to reassure everybody that staff safety is our absolute priority. It's worth remembering perhaps that most of us are going to become infected with coronavirus at some point, regardless of what we do. The vast majority of us will experience only a very mild or moderate illness. Some of us won't even know that we've got it. Any member of staff that falls into one of those groups that makes them at risk of having a more serious illness shouldn't be in the workplace. They've already been sent home. That's not negotiable and it won't affect their pay. Similarly, any member of staff that might be displaying symptoms that might suggest they could have coronavirus, or if they're living in a household with somebody else who does, again, they shouldn't be in the workplace, they should be at home, it's not negotiable, it won't affect their pay. Now, PPE is an issue that's being raised a lot by members of our staff, trade unions, and right across the media. When people are feeling fearful or uncertain, it's just human nature to look for high-tech solutions to the problems that they feel they have. So it's absolutely inevitable at times like this that people are looking for medicines or vaccines or PPE to protect themselves. In doing so, we can forget that there are several measures that are not only much more simple, but are also far more effective at preventing the spread of COVID-19 than PPE is. You'll have heard stories in the media about PPE supply chain issues. It's true, the demand for PPE has never been greater than it is now. But that said, I just want to assure you that the guidance we've developed for the use of PPE has not been influenced in any way by potential shortages. It's based purely on the best available science, which tells us when PPE is likely to reduce the overall risk of spread. So the guidance being used in Sheffield is consistent with the guidance developed nationally by Public Health England. It's being used by all NHS and social care organisations across Sheffield and in fact South Yorkshire. If we all follow it, we can ensure that the spread of COVID-19 is both minimised whilst also ensuring that PPE stocks are protected for staff undertaking roles with the highest risk of infection, such as those working in intensive care units in hospitals. To know why PPE is helpful in some circumstances, it's important to understand how coronavirus is spread. That's going to be the subject of video number 2.